welcome back everyone. So we're going to be doing part 3 here of our heart lecture. And in this, pretty much the majority of this part, we're going to be looking at something called the cardiac cycle, right? The cardiac cycle. So during the cardiac cycle, what this is it's essentially a sequence of events that's occurring in the heart during one contraction, right? So during one contraction relaxation cycle, if you will, what's happening? That's this cardiac cycle that we're going to discuss, right? So all events in the heart from the start of one heartbeat to the start of the next, right? So a few terms that you should be familiar with. One of these is systole. That simply means contraction. Diastole, this means relaxation. You should also understand the relationship between pressure and volume. So meaning as you decrease the volume of a space, you're increasing the pressure of the fluid in it, right? So this is going to have to do with our changing of our ventricle size, right? So in other words, when we contract our ventricle and when we relax it, we're changing the volume, and thus we're changing the pressure, right? So as you contract, the pressure increases. As you relax, the pressure decreases. And then in terms of the movement of fluid in response to that, fluid is going to move from areas of high to low pressure, right? So as we go through these different phases in a moment, consider what is happening to the volume in a chamber, all right? So as a result of contraction or relaxation, so systole or diastole. Consider what is then happening to the pressure of fluid in that chamber, and then that change in the pressure, is that going to cause the fluid to move in a particular direction, right? So consider some of those things, right? So we're going to be looking primarily at the ventricles, not exclusively at the ventricles, but primarily, and we'll look at ventricular relaxation and ventricular contraction, right? Now, another thing that you should consider as we talk about these different phases is what's happening to the valves, right? What's happening to the valves of the heart during each of these different phases. So remember, you have your AV valves, your atrioventricular valves, and you have your semilunar valves, right? So tricuspid and bicuspid are AV, aortic and pulmonic are semilunar, right? So think about what's happening to those as well, right? So this image here, this is a summary of all of the different phases, all the different parts of our cardiac cycle that we're going to look at. And it begins when we're at rest. So our heart is at rest. Our chambers are filling with blood. Certain valves are open, certain valves are closed, and we'll go from there, right? So the very first phase is called atrial relaxation, right, and ventricular filling. So what this means is that our atria are relaxed and our ventricles are filling, right? So if our atria are if they are emptying the blood, so our atria are relaxed and blood is flowing into the ventricles, that must mean that our tricuspid and bicuspid valves are open, right? So you can see here, this is our tricuspid valve, this is our bicuspid valve. Both of those valves are open, and as a result, blood is flowing through them into the ventricles, right? Now, in reality, it's the pressure of the blood on the valves that's forcing those valves to open, right? So the blood pressure forces AV valves open, blood moves into the ventricle. And because we're filling our ventricles, our semilunar valves are going to be closed, right? So our semilunar valves, SL means semilunar, AV means atrioventricular. So our semilunar valves are closed because we're not ejecting our blood out of the right and left ventricles yet, right? But we will in a moment, right? Now, something to keep in mind, this atrial relaxation, you see blood flowing down into the ventricle. Most of the blood, probably 80-85% of the blood coming from the atria into the ventricle goes to the ventricle just via passive gravity. So passive falling of the blood into the ventricle, right? The remaining 15 to 20%, that's due to the atria actually contracting, right? So we have atrial relaxation, ventricular filling. We then have atrial contraction and ventricular filling. So initially we had the atria relaxed, and now we have the atria contracted, right? So think about what we talked about with our EKG, right? So we have in our cardiac conduction, right? So we have the SA node initiate that signal, goes to the atria, cause the atria contract, right? We see that expressed as the P wave on our EKG, right? So our atria are contracting. Our valves are going to be in the exact same state as they were in the previous phase, right? So during atrial relaxation and ventricular filling, we're going to be in the same state here in atrial contraction and ventricular filling, right? So blood is, again, still flowing through the AV valves into the ventricles. Now the ventricles are filling up with blood, and ultimately they'll fill to the max, meaning not the max in the sense that the ventricles are totally full, but for a given amount of time, the ventricles will fill as much as they can, right? What you call that amount of blood in the ventricles at the end of diastole or at the end of relaxation, you call that the end diastolic volume, or the EDV, right? End diastolic volume. You then have the ventricles begin to contract, right? So we're now in this phase called the isovolumic contraction phase, right? So I'll explain what this term isovolumic means. Iso means same, and volumic is referring to volume, right? So in other words, the volume of blood, right? So isovolumic simply means same volume, right? So in other words, blood is not leaving the ventricles or the atria, right? It is the same volume, no change in volume. So isovolumic. There is another term that you may see if you look in the text or you look in other sources, and it's isovolumetric. So isovolumic, isovolumetric. Isovolumetric is an older term, and it's not as accurate. Right? So isovolumetric means same length. So metric is referring to length, and it was initially thought, and where that term comes from, is saying that the chambers themselves aren't changing length, which is meaning the blood isn't flowing, so the volume is staying the same. But that's not necessarily the case, right? So the ventricles begin to contract, so the muscle fibers are changing length, but you haven't yet changed the volume, right? So don't use the term isovolumetric. Use the term isovolumic, okay? All right, so our ventricles are beginning to contract. This capital P, this up arrow capital P, that means that pressure is being increased. So we're increasing pressure in the ventricles, right and left. However, we have not yet increased the pressure to the point that the semilunar valves open, right? So our semilunar valves are closed, and because our ventricles are contracting, our AV valves are closed. So all valves are closed, right? So anytime you see the term isovolumic, think all valves are closed, right? There are no valves that are open in the heart during the isovolumic contraction phase, right? So again, our ventricular pressure is less than our arterial trunk pressure. So meaning the pressure in this pulmonary artery and pulmonary trunk and the pressure in the aorta is greater than the pressure in these respective ventricles. So the valves are going to stay shut, right? They'll stay shut until the pressure in the ventricles is greater than the pressure in the pulmonary trunk and aorta, and then you get ventricular ejection, right? So then you get blood actually flowing up and out of the pulmonary trunk into the aorta, and now our semilunar valves are open, right? Our semilunar valves are open. So that blood is now leaving the ventricle, right? Remember, we had some amount of blood in the ventricle before that was called end diastolic volume. Some amount of blood is leaving, and that amount of blood that leaves is called the stroke volume, right? Stroke volume. That is simply the amount of blood that leaves each ventricle or one ventricle during one contraction, right? So you may see, more in a clinical context, you may see stroke volume expressed differently. Sometimes it's called ejection fraction, right? And it's simply all that is, it's the same measure, but instead of a raw number in milliliters, it's a percentage, right? So in other words, if you had 100 milliliters as your end diastolic volume and 60 milliliters left during a contraction, your stroke volume would be 60 milliliters, and your ejection fraction would be 60%, right? So sometimes it's expressed as a percentage as opposed to a number, right? Now, after your ventricles contract, you have the stroke volume leave. There's still some blood left over, right? So we actually don't completely empty our ventricles when they contract, right? So the amount of blood that's left over is called the end systolic volume, right? So systole means contraction. So this is the amount of blood left over in the ventricle after contraction, right? And it may be 30 milliliters, it may be 40, something like that, right? So you can calculate end systolic by taking your end diastolic, so again, say it's 100, minus your stroke volume, so maybe that's 60, and the leftover amount is 40, right? So your end systolic volume would be 40 milliliters, right? So after your ventricular ejection phase, you then return to another isovolumic stage, but instead of isovolumic contraction, this is isovolumic relaxation, right? So again, isovolumic, when you see that term, all valves are closed, right? All valves are closed. For isovolumic, again, same volume, essentially think no blood is leaving the ventricle, right? Or leaving the chambers at all, right? There can be blood movement, so in this case you see blood coming into the atrium, right, left and right, but no blood is leaving. So when you think isovolumic, same volume, essentially think no leaving, right? Blood is not leaving, right? So blood is flowing into the right and left atria. It is filling in the atria, but the pressure of the blood in the atria is not greater, so it's less than the pressure in the ventricle. So it's greater. So the pressure in the atria is less than the pressure in the ventricle. So our valves are going to stay shut. Our semilunar valve. Our AV valves, right? Once the pressure in the atria increases greater than ventricular pressure, then you get the AV valves opening, and then we're back to where we started, atrial relaxation and ventricular filling, right? So again, these valves are going to remain closed until the pressure in the atria becomes greater than the pressure in the ventricles, right? So again, both sets of valves are closed, right? So you can see a summary slide here of what's happening. So these phases, so again, atrial relaxation, ventricular filling, atrial contraction, and ventricular filling. So the only real difference there is what's happening with the atria, right? And then you have your isovolumic contraction, ventricular ejection, and isovolumic relaxation. Okay. So again, for each one of those, think about what's happening to the volume of blood. Think about what's happening to the pressure in the respective chambers, and then think about what's happening to the valves, right? What's the state of the valve? So consider those three things. What's happening to the volume of blood, what's happening to the pressure inside the chamber, and what's happening to the valve, right? So we'll stop here with this first part, and then we'll pick up in our next part, and we'll begin looking at a graph that kind of plots a bunch of different cardiac features together.